What's up, everybody? My name is Aaron.
I'm Reed with Trip Time Essentials, and welcome to our ketamine deep dive.
Today we'll be covering history and background, mechanism of action, isomer differences, research benefits,
expected effects, administration and dosing, risks and side effects, current accessibility, and other tips for use.
Before we get going, I want to emphasize that this is separate from my role as a licensed psilocybin facilitator.
And this is separate from my role in naturopathic medicine. To clarify, we never recommend the use of illegal substances.
The Trip Time Essentials YouTube channel does not contain medical advice. Always consult a physician regarding medical decisions. All content on this channel is strictly presented for educational, informative, and entertainment purposes only, which is suitable for advertising according to YouTube guidelines.
So starting off with a little bit of the history and background here.
Yeah, so ketamine was first synthesized in 1962 by Calvin Stevens, a researcher, as part of efforts to develop a safer alternative to PCP, or phencyclidine, which was a dissociative anesthetic also being used at the time.
Its dissociative anesthetic properties were quickly recognized, and during the Vietnam War it became a battlefield staple used for surgeries and trauma management without significantly suppressing respiratory function, which we were seeing with opioids.
Yeah, opioids at the time, when they still do this, they suppress respiratory function, often a cause of death and overdose. So a big issue, especially on the battlefield when maybe things are hectic, you don't know if somebody's already been dosed. So, ketamine was a great alternative. They later did kind of figure out that there were some problems with ketamine due to its psychoactive effects. And it ended up being pulled away from this kind of use, but it still is used in anesthesia.
Yeah, still used in anesthesia, and has unique effects on the brain. Have made it a key player in modern psychiatry too. It's particularly used for things like treatment-resistant depression, treatment-resistant PTSD, and we see it legalized across all of the United States. It's a Schedule 3, unlike things like psilocybin and LSD and other of your more common psychedelics, which are Schedule 1, meaning federally illegal.
Yeah, so currently ketamine's the only psychedelic-like compound that's being used across the whole US for psychotherapy. We have psilocybin in Oregon.
Yes.
Not really in the medical framework, but in its own framework. But other than that, ketamine is really the only thing that's accessible right now.
Yeah, and psilocybin's now in Colorado as well.
Right.
As of today, became their legal structure just got implemented. But again, it's still a Schedule 1 on the federal level. And so, illegal in other places. And we have a video on that deep dive.
Yeah. So diving right into the mechanism of action of ketamine. So the primary mechanism here is blocking the NMDA receptor, the N-methyl D-aspartic acid. This is part of the glutamatergic system. Glutamate is this neurotransmitter, actually your most common neurotransmitter in the body that acts as like an excitatory neurotransmitter. So it creates like a more excited mood. It's important for learning and memory in synaptic plasticity, which is like the ability of neurons to connect with each other. Basically, ketamine's coming in and blocking one of the main glutamate receptors, which is the NMDA. And by doing this, it has a lot of activity.
Yeah, it's very interesting. And by blocking NMDA receptors, ketamine reduces overactivity in certain neural regions and circuits, which is believed to help alleviate symptoms of depression and PTSD.
Yeah, and to expand on just that little point as well, people with depression have been shown under brain scans to have kind of aberrant signaling. This means signaling that's not normal when it comes to this glutamate system, excess firing in certain pathways that are involved in, negative behaviors, negative thought patterns. So ketamine's kind of coming in and, blocking that overactivity, just like you said.
Absolutely. And what it's doing is it's also promoting the release of brain-derived neurotrophic factor, BDNF, which is aiding in the formulation of new neural connections, a process called synaptogenesis.
Yeah, and depressed patients have also been shown to have reduced neurogenesis, reduced levels of BDNF, and a lot of the underlying mechanisms from the benefits of SSRI treatment actually is more thought now to be mediated through BDNF increases.
That's pretty amazing.
Yeah, a lot of this really comes down to neuroplasticity.
Yeah,
very interesting stuff. And ketamine also has a lot of other pharmacology. There's a lot going on here. So everybody knows, in general, somewhat about the NMDA. If people know anything about the mechanism, they've heard NMDA when it comes to ketamine. But there's other stuff going on. So there's GABA interneuron inhibition. Not quite sure what this does, but we do know some other things here. AMPA receptor, the AMPA receptor, when that's also activated by ketamine. That's important in long-term memory formation and some of that antidepressant effect. We did just talk about that BDNF. BDNF is acting on the TRKB receptors. So that's the tropomyosin kinase B. So they're signaling there through BDNF and directly through TRKB. And this also We see downstream effects with mTOR, the mammalian target of rapamycin. This complex is associated with protein synthesis, activation of protein synthesis. A lot of bodybuilders may know about this way. It helps form new proteins in muscle, but also proteins in the brain. So there's some growth happening. All ties back into this neurogenesis.
Yeah. And then glycogen synthase kinase 3 beta, GCK3B, a little bit of a mouthful there, and postsynaptic density protein 95. So
yeah, these are also just targets that are activated by ketamine. We do see some GSK3 beta activation with lithium as well, which has also been shown, as a antidepressant and as like a bipolar treatment medication, been shown to increase brain matter. So some neurogenesis happening there. So this target is probably relevant as well for some of the antidepressant effects.
Yeah, and if you're enjoying this video so far, please like, comment, share, and subscribe. We'll be producing continuously more interesting videos to come. So talking a little bit the isomer differences, right? Ketamine, there's two different isomers, and one is R-ketamine and one is S-ketamine. And while both have similar core effects, there are some pretty extreme differences, or at least notable differences between them.
Yeah, so S-ketamine is believed to be more potent and as anesthetic. And it is more potent by binding to NMDA receptors 3 to 5 times more affinity to those receptors. So it binds more strongly than the R form of ketamine.
More powerful.
Right.
And to put that into layman's terms.
Yeah. And this is the isomer that's used in the FDA-approved nasal spray, Spravato, for depression. There's some interesting things, to say about that coming up here.
Yeah.
And then there's R-ketamine,
which demonstrates fewer side effects and longer-lasting antidepressant effects in preliminary studies, right? Again, preliminary studies, though not yet widely available. It's generating significant research interest, and we'll be getting into some interesting research there that's already out, right? And again, preliminary studies, but possibly how these might be used together to be most effective.
Exactly. So yeah, with a study that compares the two isomers at the sub-anesthetic doses, the ones used in therapy, found that users had a more negatively experienced psychological state when given only the S isomer. So when given only S-ketamine, there was a little bit more negativity to the experience.
Yeah, which is a big data point.
Yeah.
Right? Just recognizing that alone.
Yeah.
Just the S isomer having more negative effects, it really brings into question, should there be more R isomer and should both be getting measured and used together in the right amount?
Yeah, in the same study, the researchers hypothesized that including the R isomer adds a protective effect to, against some of those negative psychological states, and that like the ideal form should probably contain the R isomer.
This is a hypothesis, right? We're not stating that this is true.
Yeah.
Just an interesting fact, and there'll be more research down the line, I'm sure, on this. There already is, research continuing to be done. But this also raises some questions regarding the efficacy of the S-ketamine nasal spray.
Yeah, it really does. And even though we know there's still an effect. There's still a positive effect from the S-ketamine alone. But if you can have a more well-rounded effect, that's worth knowing and worth exploring.
Absolutely, because power is like we talked about, that S-ketamine is more powerful,
right?
But like we've learned with other psychedelics too, more potent is not necessarily more therapeutic.
Yeah, exactly. And maybe some of these other targets we talked about mechanistically, maybe R isomer is working more on those. We just don't know.
Exactly.
All hypothetical, but it's very interesting. And often we hear thrown around that the S isomer is just better. Yeah, that's what I've heard on a few podcasts. And that
not enough research, honestly, yet to state that.
Exactly.
Either way.
Yeah.
Even though we know that S does have benefits, as we're talking about today, right? So some of the research benefits around depression, ketamine is a breakthrough drug for treatment-resistant depression. Studies show rapid symptom relief, right, within hours. So depression reduction is noted as soon as 240 minutes after administration. So that's extremely fast after administration. And anecdotally speaking, some people even talk about during the session. They're feeling less depressive like effects.
Absolutely. And to put that in perspective, SSRI treatments, conventional antidepressant treatments, take weeks usually to have a measurable effect, if they even have that measurable effect. It depends on the person. So to be able to note, clinically speaking, that depression reduction, even 240 minutes after administration, it's huge.
Significant, yes. Yeah. And then also it continues, the depression symptoms continue to decrease until 72 hours after administration. So this means that the symptoms of depression are continuing to get less and less up until that 72-hour point.
Yeah. So it's some people might argue, oh, if, maybe it's just the high of the experience that's making someone feel better, but the drug's out of your system, way before that 72 hours. So it would be kind of hard to argue that it's really just, oh, this person's high and they're feeling better.
Yeah, there's more going on.
There's more. We have, depression getting, even better all the way to 3 days, and then some level of sustained response after that.
Yeah, some level of sustained. We're going to get into that a little bit too.
Yeah, exactly.
And then talking just a little sprinkle of dose here in these clinical trials where we get some of these numbers of 240 minutes and 72 hours.
Yeah.
The suggested optimal doses for depression are between 0.5 milligrams per kilogram of body weight and 1 milligram per kilogram of body weight via IV infusion.
And moving on to the anxiety disorders, a lot of research here as well. A review of the literature for anxiety disorders found ketamine consistently producing an anti-anxiety effect across a bunch of different populations. So multiple different conditions here: generalized anxiety disorder, anxious symptoms in depressed patients, anxious symptoms in bipolar disorder.
Yeah, social anxiety disorder. You see that a lot. Obsessive compulsive disorder, more mild effect sizes from the ketamine there. But, a lot of this theory maybe comes from the dissociative factor of ketamine. And so what that means is we're having an emotional distance essentially from what we're processing. And so things like, maybe social anxiety disorder, you could be processing a social environment, thinking about that, going through that process, but you're dissociating from that emotional connection to it, that emotional anxiety that maybe you're feeling during that time.
Yeah, which can be really valuable for people. So
absolutely.
Super interesting to see here, affecting both depression and anxiety, and then also PTSD.
Yes.
So this one is a little more convoluted when we analyze the data, but we do see, a trend towards an improvement. And we see, burn victims. So this is people who have just recently been in some kind of accident where they have, first degree burns, or you have some level of burn. They're in the ER. And if people are given ketamine during that operating room experience, there seems to be a reduction in PTSD symptoms from that event.
And some of that could be from, like I mentioned, that emotional disassociation that's going on with the event, right? If the event is having less of a traumatic impact on our emotions, right, holding on to that and retaining it for a short amount of time, then it's going to stay with us and cement in us less extreme.
Exactly.
Right? In a lesser extent there.
Right. Interesting thing to pull out of this review on the PTSD symptoms, as this is all part of the anxiety literature that we talked about, is that it's only a short-term relief of PTSD symptoms, at least according to this literature, about a 1 to 2 week relief. And then after that, not statistically significant anymore, whether that still is having an effect.
And so this is why, oftentimes in clinical trials or just ketamine clinics, actually, nowadays, you see continuously coming back, for treatment once a week for a few weeks, usually, 6 sessions or something like that.
Of 6 is pretty standard.
Yeah.
And whether that series of 6, maybe is able to sustain the benefits longer, I don't know if we really know that. There's definitely research happening there, but it makes sense in theory.
Yeah, and
that this could extend the benefits.
Absolutely. And we're going to get into some other interesting research that we've come across on that possibility of just more infusion for longer duration affecting that timeline.
Yeah, very interesting stuff.
A 2024 systematic review on ketamine for PTSD found a significant reduction in PTSD symptoms, but a large variability across the studies.
Yeah, so basically, it wasn't consistent in every different tested population if it actually helped the PTSD symptoms. So it might really just depend on what kind of trauma, what exactly the person's involved in, what their life is like. And it's hard to say with certainty, but when they look at all the data as a whole, they do find that trend towards a reduction.
And some of this, it's interesting. I recently just was listening to a podcast that talks about it actually. And some of that difference in PTSD could come from what's causing it. There's theories around that maybe an acute form of, or accident that occurs is possibly easier to process with ketamine, maybe different than like a childhood trauma that's going on for years.
Very long lasting trauma. Okay,
because it's harder to just process that one memory again with that dissociative property of the emotion, right, for a really long time. But one specific event is a little bit easier because now you can go through that and process that one day.
Yeah, it makes a lot of sense. The last big highlighted research benefit we're going to go over is chronic pain. This is one that a lot of clinics are doing. They're treating chronic pain with ketamine, and we see a lot of success stories here. But when we look to the research, found that the low dose ketamine. So this is actually not an infusion type setting. This is like some either oral or nasal spray of ketamine, usually at like a daily dosage. Found that is beneficial for nerve pain. But when we then look at the infusions for ketamine, we see kind of a different story with what kind of pain it relieves and how long.
Yeah, so it's also been found that short-term ketamine infusions can relieve pain only during the infusion. Interestingly enough, though, we did some more research and found that longer infusions over 4 to 14 days long can have pain-relieving properties that last up to 3 months. So much longer. And that it's interesting. I'm curious to see what happens with research and down the line if that's similar with PTSD or with depression.
If we can get people into this dissociated state where they're, separated from whatever condition is afflicting them for, a sustained period of time, you start maybe wiring those neural pathways, those, to get away from the ones that you've been bogged down with over time.
Yeah.
And, pain is still a very, brain-based sensation. It's not just coming from the periphery of your body. It's not just a physical thing. A lot of it's mediated by the brain.
Absolutely.
And
see with ghost limbs and things like that, when you still have that pain there, even though you're not physically having the pain, you're feeling it still. Very real still. But
pathways in the brain have been wired for so long to still feel that you can have the sensation even if it's not coming from anything. Which is pretty crazy. And so to see that, infusing over a period of days can actually maybe interrupt that, at least for a period of multiple months, is very interesting. And also important to note that most clinics who are treating chronic pain are not doing sustained infusions like this. I mean, the practicality of it is how do you do it?
It's hard to have somebody be getting an infusion for 4 to 14 days long. That's a significant amount of time.
Yeah.
And money, to run that type of clinic. It would be very expensive as well. So it's curious in terms of future pain management.
Yeah. Definitely promising, but some intricacies to work out and see where the research takes us.
Yeah, and lots more research needed here, to fully confirm any of these things we're talking about.
Yeah, and then there's some emerging research as well into some other things that ketamine might be applicable for. We see potential for treating OCD, substance use disorders, and even Alzheimer's disease. And just a lot more studies are needed to know what's going on here. But
it's promising, but simply more research, more trials need to be done. There's also some interesting research in the possibility of reducing some suicide risk as well.
Yeah, which is interesting to see when compared to other antidepressants may sometimes increase suicidality. We see that sometimes with SSRIs. Some people it helps, some people it can actually worsen it. With ketamine, we do see a trend in reducing suicidality. And
this is an even interesting spot to highlight because, if you are in a spot of suicide risk, if you have a plan, another psychedelic sometimes can increase that drive, that feeling, right? Specifically, like if you have a plan, if it's a strong, again, talk to a professional one-on-one about this, but interesting that ketamine possibly plays a role in actually just reducing that suicide risk.
Yeah, it could be huge. If a lot of our treatments that exist are not safe for people who are suicidal. So to have a possible option here, this is super preliminary in the grand scheme of things, but it is very interesting, very promising. And we also see some benefit of ketamine in adapting to stressful situations. So in a little bit of a broader sense, this really ties into what's going on with those NMDA receptors. So like we kind of said earlier, people with like depressed brains or some of these conditions with mental health conditions, the glutamate system is a bit off balance. There might be overactivity happening. So being able to come in with ketamine and interrupt the signaling is probably what's having a lot of benefits. And we saw with the anxiety, we want to benefit so many different types of anxiety. So just being able to adapt to stressful situations in general seems to be something that ketamine might be able to do.
Yeah, it's really interesting. It's like practicing in those types of situations for longer with a different emotional response.
Yeah.
Just practicing that.
Yeah, kind of that exposure therapy sort of idea.
Exactly. Without the kind of risk of your emotional distressing, side of stuff.
Yeah.
Continuing on here, we talk about the expected effects. You've heard me mention disassociation. That's going to be the biggest thing. Ketamine is a dissociative, right? So and what that means is it's a feeling of detachment from one's body and surroundings, as well as a detachment from that internal emotional state. So the feelings that you have going on. Some describe it as an out-of-body experience.
Yeah. And then we also have a bunch of perceptual changes. It's a hallucinogenic psychedelic type dissociative. So it's a lot of effects going on here. You can have an altered sense of time. You can have some enhanced visuals, distorted visuals, even closed eye visuals that are going to be different from what you'd see on a serotonergic psychedelic like LSD or psilocybin.
And you get some of those emotional shifts going on too, right? Like feelings of peace, clarity, maybe heightened ability to process emotions, euphoria.
Yeah.
Right? And also cognitive impairment along with that.
Right. Yeah. During the experience, you are measurably cognitively impaired because you're blocking these receptors that are so important for learning and memory. It's a temporary blockade, which then has downstream consequences that are actually beneficial to adapting to new memories and everything. But during the period, you are not going to be quite as good at math, for example.
Don't do ketamine and go take a quiz, go take a test. And actually cognitive impairment is something we're going to get into as side effects down the road about daily use of ketamine. So recommend watching that part of the video as well and hanging on. So, to bring up some of those effects too, a lot of that has to do with the amount that you're taking and the way that you're taking the administration.
Yes.
Right. So moving into administration, dosing, and duration, the most common used in clinic, the most common use for administration is going to be intravenous.
Yes.
Or intramuscular, right? Either one. And that's because it's by far the most bioavailable.
Yeah. Most quick acting, most bioavailable, very standardized dosage, able to be done with the vial and the syringe in the medical setting, sterile, everything's sterile. So that's what's become most effective. You're not wasting any drug that way.
Yes.
It's most cost effective for the clinic. And you can actually get a shorter experience out of that. So that's where we get to the duration. With the intravenous, we really only see like a 30 to 45 minute duration. You have some tail end effects. You're not ready to go drive after that. You absolutely should not drive after this. But it is a shorter period when compared to some of these other methods of administration.
Yeah, much shorter. You see that almost half of oral, which we'll get to there.
Yeah.
But then, you also see a lot of, also to highlight, this is very body weight based in terms of dosage on any of them, especially that intravenous, intramuscular. So when you're going into a clinic, you're not going to take the same amount as somebody who's twice your size or half your size. It is body weight dependent, unlike some other psychedelics.
Yeah, unlike psilocybin, which if you've seen our deep dive on that, it is not body weight dependent. Ketamine absolutely is.
Yes.
So you have to highlight the dosage, the average range of dosage for injection, 25 to 125 milligrams. Again, body weight dependent. So the clinic will be doing some kind of formula. They'll know your body weight. They'll give you your exact dose based on that calculation. So these ranges are very broad for that reason.
Exactly. And then, you're talking about intranasal, which is probably the most common way that people are doing this in a non-clinical setting. Yeah. And so whatever that means to you, that it's intermediate bioavailability. It's more potent than the oral aspect there. It's, like Reed mentioned, wasting, if you want to call it that, or it's just more effective how it's entering your system. And so your dosage is, you're looking up to 200 milligrams. For that intranasal, again, not a recommendation, just up to 200. Always start low if you're going to be doing some of these things, but we don't recommend any illegal use. And then that duration, right, of the intranasal is 45 to 60 minutes on average.
Yeah, which is a little bit longer than the intravenous, intramuscular, but not by much. You're really only looking at like a 15 to 30 minute longer period of time there because it is still so fast acting, the nose, and still quite bioavailable.
Yeah.
And then, lastly, we have the oral, which is the poorest bioavailability form of ketamine intake. The dosage range goes all the way up to 300 milligrams.
Which is a lot,
if not
ketamine.
Beyond for certain desired effects. Some people go above this. Of course, again, not
no recommendations
use,
here,
but oral is by far, you have to take the most substance to get the same level of effects. And it's often not reported to be quite the same because of the enhanced duration, increased duration.
1 to 2 hours is a much longer time.
Yeah. So those effects can be kind of spread out a little bit and maybe not as therapeutic of a peak either, potentially. Yeah. Typically, people don't enjoy the oral format as much, and it's not used clinically.
Yeah, it's very interesting. And then talking a little bit about half, which is, 79 minutes long. To explain to what is half-life is when there is half the amount of substance, drug, right, in this instance, ketamine, still in your body.
Yeah.
Or in your bloodstream.
Yeah, exactly. We also have a beta phase half-life. This is like a metabolite of ketamine. And this beta phase is a 2.5 hour half-life. So that's going to linger a little bit longer.
Do with that what you will.
Yes.
So continuing on with administration, we're not going to go through these charts line by line, but what this is talking about is, the different levels of the experience you're going to possibly get. Again, not any recommendations here, but generally by milligrams to pound of body weight, and just kind of where your experience is going to take you.
Yeah, so you can kind of see all the way up to a K-hole dosage. This is quite an intense.
Do you want to describe that a little bit?
The K-hole is this kind of maximum dissociated state before you get to the anesthetic level of ketamine usage. A lot of people really find therapeutic value in the K-hole level. This is definitely introduces a much higher risk when you are pushing the boundaries of dosage. So not a recommendation at all, but this is something that a lot of people are pursuing with their ketamine usage.
And so you can see that, right, to get to that K-hole would be 1 milligram per pound of body weight for the intranasal, which is a significant amount of ketamine. 250 milligrams. That is a significant amount.
Yeah, definitely. And again, to highlight the poor bioavailability of the oral form, to reach that same K-hole threshold, you're looking at 3 to 4 milligrams per kilogram of body weight, which is 3 to 4 times higher of a dosage. So very poor bioavailability. Most people aren't using ketamine like this.
Yeah, and then also, when you're talking about duration, you can see on the chart here, onset 5 to 15 minutes for that intranasal, and then 5 to 20 minutes for the oral there. And then the after effects, something interesting to talk about that we haven't really highlighted yet, but the normal after effects for the intranasal are 1 to 3 hours, right? So that's after the duration. That's after those 60 minutes are up. The oral ketamine after effects can last up to 8 hours, maybe even longer for some people, but 4 to 8 hours is kind of that range that we see.
Yeah, so not only are you using more material and possibly having some of those downsides there and being stuck in the experience itself longer, but you also are stuck with some after effects longer too. So something to be aware of there. And we again won't go super deep into this intramuscular dosage chart, but we can see a little bit lower of a dosage range to get to the K-hole. So that's 0.75 milligrams per pound. Sorry if I said kilogram on the last one there. It is per pound. So yeah, lower dosage there. It is just the most bioavailable. You're almost, with injection, you're getting nearly 100% of drug delivered into the bloodstream.
But also, this is something where you should absolutely be in a medical setting whenever you're doing something intramuscular, intravenous. It takes a lot of training, and it is, maybe the most effective, some could say, right? Most effective in terms of bioavailability. And so that's why there's so many clinics out there
and
that
also
do this work.
The highest risk when you introduce something that is so potent.
Yeah, absolutely.
It's definitely something to be doing not in the comfort of your own home.
Yeah. And then, continuing on here, we're talking a little about the risks and side effects from ketamine. What does that look like? Some of the most common we're seeing are nausea, dizziness, and elevated blood pressure. So the nausea, it's a little bit lower of an incidence rate compared to things like psilocybin.
Right.
Some of the other more common psychedelics as well, but there is still cases of nausea, and in clinic, they'll often put a little bit of anti-nausea maybe in the drip, or you'll take something that's anti-nausea as well.
Yeah, and really important here to highlight some of the serious risks of prolonged use. So this really is applying to people who are abusing ketamine or taking it daily at significant dosages for a long period of time. So this includes bladder toxicity. This is one of the most severe of the side effects, called ketamine cystitis, bladder inflammation, bladder toxicity. And this is, it can be really painful urination, and it's a real medical problem. If you go in the online community and you can read about people who are struggling with this issue, very much can discourage you to not use ketamine daily. But this brings us into the next point. Yeah. There is some level of psychological dependence with ketamine use. And we do see, a significant incidence rate of people who become addicted, dependent on ketamine usage. And that is why it is so important to, treat this as a therapeutic medical intervention, to, do it at a clinic if possible. And
don't abuse it, right? So we're talking like Again, don't do this every day, right? That's what a lot of this is pointing to, especially at a substantial dose, right? Where you are feeling it. These are backed by research, these serious risks, right? Including substantial cognitive impairment. So this is similar to other dissociatives like PCP, DXM. You see this affecting IQ, just brain processing and
ability to, speak articulately, to comprehend, to read, to write effectively. Pretty much every parameter of cognition can go downhill with chronic ketamine abuse or any dissociative abuse. I don't want to say if, the oral prescriptions or the, sublingual prescriptions or the nasal prescriptions of ketamine that are given daily, if they can ever add up to anything like this. I don't know if we have that data. It's a pretty new phenomenon for clinics to be giving people ketamine in a daily use format. It is being done now. I can't say if any of these can even ever develop at this, clinical dose range.
Yeah, we don't know. It's just something to be aware of. And the research at this point, it also would seem that it's not saying it can't.
Yes.
Right. We don't know if these types of things can occur with those daily use cases.
Yeah, it's theoretically possible.
Yeah. And so we just wanted to highlight that, it's pretty big. Also, just cycle back to that elevated blood pressure you see up there. This is a moderate level of elevated blood pressure, but it's still something to be aware of, especially if you have a heart condition.
Yeah.
If moderately raising your blood pressure could be dangerous, a red flag, probably for doing some of these things. So again, be aware, talk to a professional before proceeding, and just be aware of the risks if you're doing this in general.
Yeah, and then one last risk to point out here is just the fact that this is an anesthetic, and if you overdose, you could reach the anesthetic threshold and be past a K-hole and into a point where you're not remembering anything and you're not conscious, and this could be quite dangerous.
Yeah, it can put you into anesthesia. I mean, that's what ketamine was used for before it became into the therapeutic kind of field.
Exactly.
It was used for anesthetics.
So just being aware of that, if you are doing this, outside of the medical setting, weighing out the dose with an accurate scale.
Very safe.
Is what has to be done.
Yeah, so, absolutely. Don't just look at a pile and be very precise. And that's why, it's oftentimes safest to do some sort of clinical path there.
Yeah.
And then talking a little bit about drug-to-drug interactions. So, some of this, again, no recommendations. There's still research. A lot of research still needs to be done before any of these things are used on a large scale with ketamine. But for instance, rapamycin, there's preliminary research suggesting that pre-treatment of rapamycin extends the antidepressant effects of ketamine for a significantly longer period of time.
Yeah, some of the research into this shows quite a substantial improvement in the duration. It was close to a 3 times increase.
Wow.
In durability of effect with the combination. So they pre-treat the ketamine use. So before you get the ketamine, they give the rapamycin. This is animal models in a way. This has not been confirmed in humans.
That's why it's preliminary research. We're not saying that this is how it is in humans. But
there is at least a clinic out there that is doing this combination. It's very interesting. One of the targets we mentioned, mTOR, the mammalian target of rapamycin, a lot of this signaling might be happening through that pathway. And this extension of effects might be because of that. But yeah, again, very preliminary. And then the next 2 medications on here are just medications that actually block the effects of ketamine or reduce its benefits. So lamictal or lamotrigine, some research shows that it just kind of attenuates or blocks the effects of ketamine, and you're not no matter how much you take, you're just not getting the same effect that somebody at that same dose would get. And then benzodiazepines,
Xanax,
Xanax, these reduce the duration of the antidepressant effect of ketamine. So for people who are taking these meds for anxiety or sleep, for whatever purpose, they're not going to get as much antidepressant effect.
Yeah, possibly. We do know that blunting is different for everyone, right? How much it's going to blunt. If there is blunting going on, like Rita mentioned earlier, some of those antidepressants can take a little bit of time before they start working.
Right.
And so, doesn't mean you're going to have blunting right off the bat. Just something to be aware of. But you could.
Yeah.
You probably would. But again, not a guarantee. Current accessibility, talking about where can you get ketamine, right? How can you access it? Ketamine-assisted therapy, psychotherapy is widely accessible through medical providers across the United States. As we talked about earlier, it is a Schedule 3, meaning that you can access it, especially going into a clinic, and you can get it prescribed for you.
Yeah, and just interesting business models that have opened up are virtual ketamine-assisted psychotherapy, and that's where you have visits virtually with a doctor. They see if you're qualified, then they ship you the medication, the ketamine, and you have some kind of virtual way to connect during the session. So this is something that is happening. It is more accessible if you're not in an area that has a local clinic. Maybe it's more affordable. Not sure on if the efficacy is on par, but it is something that's available. Outside of these options, though, and outside of medical research studies, acquiring and using ketamine is all done at your own risk.
Yes, absolutely. And do your own research on laws of where you are for that. Tips for a good experience, right? This is similar to many other psychedelics. We're still going to cover some. Have an intention for what you are wanting to accomplish with this ketamine usage. That means maybe journaling about your purpose, your intention for a period of time before your journey, maybe a couple of weeks. Right, talking to someone about it, or just, again, getting that process flowing so that while you're going through your therapeutic experience, right, you know why you're there, and you don't have to figure out why you're in that chair doing ketamine at that point. You have a reason for being there.
Yeah, important also to set aside dedicated time for the experience before and after. At least a full day.
Yes,
is ideal,
and maybe again, day after too. Yeah, to emphasize that. We want to ease back in to regular life again. Yeah,
these experiences can completely separate you from the flow of your normal daily life. It can be a very good thing. It can happen in a very good way, of course, but it still can be disruptive, and you just need to recalibrate.
Absolutely.
So important to set aside that time so there's no added stress.
And it can be good to, have your playlist selected, ready to go before your journey. You don't want to be, messing around with what you're listening to during the session. Again, it's a dissociative. So you might be leaving your body or something like that.
Yeah.
And just having that planned in advance takes a lot of stress away from the situation. Good. There's a lot of playlists out there too that you can use.
Yeah.
There's stuff on Spotify. I make playlists as well, and some of those are public too. So just have that planned out. Save yourself a little stress on the day of.
Yeah. And then, a few other things here. Utilizing essential oil diffusers can be really nice to set the mood and to lower some of the stress of this new situation, and it can be comforting to have some, familiar scent, your favorite essential oil, whatever that is. And then we also have our pre-trip supplement that is launching quite soon, and this is designed to soothe the mind and the stomach and protect against undesirable effects.
Yes. Also, talking about access to ketamine-assisted psychotherapy through a clinic in your area or virtually for the most optimal and safe experience. We don't encourage any illegal activity. And so virtual and in clinic is going to be the safest way, right, that you can do this.
And probably the most therapeutic too.
Yeah.
You've got the license.
It's designed for it.
Yes.
Right. You're going to these places where it is their job to create a set and setting that is effective for your ketamine experience.
Thank you all so much for joining us on our ketamine deep dive.
Remember to hit that like button, subscribe for future content, and comment with any questions, concerns, or requests for future content.
And remember,
elevate your trip.